My name is Jane Hickey. I am the Clinical Nurse Manager 3 in the operating theatre in the Rotunda Hospital. We have a busy department and we have quite a lot of sections every day. We have anything from 6 to 10 elective sections during each working day of the week, and then emergencies obviously as well coming in on top of that. So we will look forward to meeting you on the day of your surgery, and hopefully we can make it a very memorable experience for everybody, and we can't wait to meet you all when you come in. Thank you. So what to expect on the day of your surgery? We are hoping, we understand that everyone will have a great deal of nervousness coming in on the day, and we do our ultimate to make sure that we can make it as happy as an experience as possible. When you come in, you'll be coming in through the admission room, and we determine the time of the day before, depending on why patients are having the cesarean section. Some may need to be done in the morning, some can be left till later in the day. It depends on several conditions during pregnancy. So you could bear with us if you are later in the day, but we will always try to make sure that you have breakfast early in the morning if you are going to be later in the day, or water, certainly be able to drink water up to a certain time of the morning. When you come in through admissions, you'll be greeted by the admission staff, and then you'll be sent up to your relevant ward. On the ward you will be admitted by one of the midwives, and sometimes one of our own theatre midwives may go to help to get you ready. If you're first thing in the morning, and some people do start at 8 o'clock in the morning, it will be an early riser, and you would be coming in possibly for 6:30 or 7:15 in the morning, that early. So we get you ready on the ward, and then when we call for you, you're brought down to theatre by the midwife who gets you ready on the ward. We will meet and greet you in theatre in a little cubicle. We will take you through just a quick checklist to make sure that everything is okay and ready to go, and we ask you all the same questions. You may be asked the same questions about 3 or 4 times going in, and that's all relevant to whether you're fasting and your medical and surgical history, questions like that we will need to go over. After that, once we've checked you in, you're going to meet your midwife who's going to be looking after you for the case, and we have some really, really lovely midwives up in theatre, so they'll be very gentle and they'll take you through whatever questions you have on the morning of or the afternoon. They will take you through, and no question is a silly question. We are open to answering anything that you may have, so please don't be worried about asking us anything that's on your mind. We will let the midwife have her little turn. She will take you through her side of the whole surgery and what her area will be, in that when she takes the baby at the time of surgery, right up to recovery when you are breastfeeding or bottle feeding your baby. We give her about 10 minutes. She'll have 10 minutes to talk you through any queries that you might have. Then we will ask the anaesthetist to come in and talk to you, and they'll come in and talk to you about the type of anaesthesia that you will have, whether it is spinal, and on most cases it is spinal anaesthesia, or for some reason if you have to have another type of anaesthesia, they will talk you through it. At that stage you will have either met your obstetric team, or you will meet the doctor that's going to be operating on you in the cubicle as well. So there's a few people to meet you and greet you at that stage, so the time goes very quickly. The dad at this stage, he'll be quite nervous too, and we try to put all the dads at ease as well. The dad may have some burning questions as well, and you feel free to ask us as well. We get the dads into a purple coloured scrub suit like my own here, so that they do stand out and we know where the dads are at all times, and in case they go into the wrong area in nervousness, so we know where you are. So we would ask the dads to stay in the cubicle while we bring the mum into theatre. When we're bringing the mum into theatre, the first thing we will ask you to do for the spinal anaesthetic is to sit up on the table, and we will position you for the spinal anaesthetic. We will put some monitors on you, the blood pressure cuff, some little dots on your chest for reading the ECG, and the midwife will be at your side the whole time. You'll never be on your own, and we also have care assistants in theatre to give you a hand. It will seem sometimes that there's a lot of people in there because we have 3 nurses, we have the obstetric team of doctors, we have some anaesthetists, and we have the care assistants as well. So sometimes it does seem like there are a lot of people, but we will try and keep you focused on just your little area and position you for the spinal anaesthetic. Once the spinal anaesthetic is in, and we will talk you through it and we'll be right by your side all the time, we will lie you down on the table because the spinal anaesthetic does take effect very quickly, and that's nothing to be frightened about. Your legs will go very heavy and we'll lie you down very quickly. We will insert a catheter, a urinary catheter at that stage. You may feel us lifting your legs, but it won't hurt in any shape or form, and it shouldn't at that stage because the spinal anaesthetic will be taking effect. Once the spinal is effective and we are happy, we will not start anything until ultimately the anaesthetist is the one who is going to tell us to start doing anything further. Once the anaesthetist is happy that spinal anaesthetic is working fully, then we can proceed with surgery. You'll be cleaned, you'll be draped up, and at that stage, once the drape is on and the surgeons are in place, we will bring your husband or your partner back into theatre. So they will be brought right up to the top of the table. They'll be sitting up here by your shoulder, your right shoulder, and they'll be with you for the rest of the surgery. Once your baby is born, which takes, the average time is usually about 10 minutes. It can be faster, it can be a little bit slower depending if you've had previous surgery or not. We will bring the baby, the midwife will carry your baby straight up to the baby heater, which is just at the top of the bed. So sometimes you might be able to see back, but it can be a little bit of a strain for your neck because you're lying down flat. But we tend to bring over the partners or the husbands to the Ohio as soon as we can. So they'll clean your baby down and they'll dry the baby off, and once they're happy that the baby's okay, they'll wrap the baby up and they'll bring the baby back over to you as soon as possible. So what they will ask you to do is to slip your arm out of your left shoulder of your gown, and then they can try and put the baby in against your skin so that you can have your skin to skin in theatre at the same time as the surgery is proceeding. All that time the surgeons are continuing with your surgery, and to be honest, you won't even be aware of the surgeons being there because the whole focus is now on your baby. And that's what we love. That's the best part, where you get to cuddle your baby and hold your baby, and your partner is there by your side, so you can both have that time. After that, when it's getting closer to the end of the surgery time, the midwife will come back to your partner, and she will ask to take the baby out of theatre with your partner, so we can finish you off and clean up the surgery site and then transfer you safely into the recovery room. Partner and baby in the meantime will go back outside theatre, and the midwife will be with them all the time. Some partners can be very nervous, especially the first time dads. If they're bottle feeding, they can be even more nervous. So I would say to you that is perfectly normal. But the midwives are there the whole time, and they will help the dads to give that first bottle if that's your wish. If you're breastfeeding, obviously there's no bottle feeding involved. If you're breastfeeding, we will wait till you are in recovery, and once you're comfortable in recovery and the recovery nurses have done a thorough check that everything is okay, they will bring the father and the partner, and the baby back into the recovery room so that you can all be reunited in there. Midwife again will be around for a certain amount of time in recovery, and then the recovery room nurses will take over from her once they're happy with the handover and that the baby is safe and well. They will check the baby's temperature as well to make sure that the baby is okay and nice and warm. At that stage, if the baby hasn't fed and it is due a breastfeed and is keen to breastfeed, we would try our best to get the breastfeeding going. If not, if the baby's fed or is just not interested in feeding, we will do some more skin to skin. So as much skin to skin as possible, that is what we would like and we would aim for while you're in recovery. Usually you're in recovery for about 20 minutes to half an hour. Sometimes a little bit longer depending on how comfortable you are, and we would hope that with the spinal anaesthetic you would be very comfortable, but sometimes you may need a little bit longer depending on your blood pressure and other things that might act up a little bit. But we will make sure that you're very comfortable and to make sure that the bleeding is okay, that there is no bleeding, and that you are ready for a safe transfer back to the ward. Once the recovery rooms nurses are happy and the anaesthetists are happy to transfer you, then we will transfer you with the porter and the recovery room nurse and the baby back to the ward.